Women's reproductive health. Reproduction is being able to have sex and make a baby. Both men and women have special sex organs. Reproductive health is taking care of these organs, preventing disease, and planning when or if one wishes to have a child. Being able to reproduce another human being is also called being fertile. Caring for the body and staying healthy is important for both men and women. A woman's reproductive organs include 2 ovaries. They make the female hormones and release eggs. Each egg has half the genetic code needed to make a baby. Usually, only 1 egg is released each month. Fallopian tubes are the pathway for the egg to reach the uterus. The uterus or womb collects a blood supply each month in preparation to receive an egg. The uterus holds the baby until birth. The cervix is the lower part of the uterus. It opens to the vagina. The vagina or birth canal opens to outside the body. A woman goes through 2 normal changes in her lifetime: menstruation and menopause. These mark the start and end of the woman's reproductive life or fertility. Women should not feel ashamed about these changes. Knowing what to expect can be helpful. Menstruation is a normal event. It is also called a period. It usually begins between the ages of 8 and 13. It marks the start of puberty, when the body begins to mature into an adult. Preteen girls should be taught what to expect. During a period, blood flows through the vagina. The bleeding usually lasts for 3 to 5 days. There may be a little, medium, or a lot of blood. Each month, one of the ovaries releases an egg. This is called ovulation. The egg travels through the fallopian tube to the uterus. If sperm are present, the egg may be fertilized. It is called conception when a sperm and egg unite. The fertilized egg or embryo travels to the uterus. Each month, the lining of the uterus builds up a rich blood supply. If the egg is not fertilized, the lining of the uterus is shed. This is called menstruation or the period. The monthly rise and fall of hormones can cause physical and emotional changes. Some women experience symptoms right before their period. This is called PMS or premenstrual syndrome. Symptoms may include cramps, pain, headaches, bloating or feeling fat, breast swelling and tenderness, nausea, getting annoyed very quickly, tiredness, mood swings, or depression. The following tips may help ease or prevent PMS. Eat a healthy diet. Get regular exercise. Get enough sleep. Use a heating pad or hot water bottle. Avoid or limit alcohol and caffeine. Take medicine as recommended by your healthcare provider. Menopause. Menopause occurs when a woman stops menstruating and is no longer having any periods. This usually happens between 45 and 55 years of age. Until all periods have stopped, it is possible for a woman to get pregnant. Menopause is a natural event and not a disease. This is a big change that affects all women. Some common symptoms during menopause may include hot flashes. They make you feel hot all over the body. Mood swings. When you change from being happy to feeling sad very quickly. Vaginal dryness. This may cause sex to feel uncomfortable or painful. Feeling tired or having trouble sleeping. Periods become irregular and then stop. Osteoporosis. This is when the bones become weak. Weight gain. Talk to your doctor about treatment options if needed. Lifestyle changes can help too. They may take a little longer to make you feel better, but have fewer risks than medical treatments. Lifestyle changes include eating a healthy diet, staying active, finding ways to relax, avoid smoking, limit alcohol use, and dress in light layers. Women who maintain a healthy lifestyle before menopause often find it easier to cope with its symptoms. Now, let's talk about birth control. Women can do something that men cannot do: give birth to children. It is important to know if you and your body are ready. Choosing when to get pregnant can help you have a healthy baby. If you are not ready to have a child, you may want to consider using birth control. Some choices are abstinence or not having sex, condoms, diaphragm, birth control pills, hormone shots, IUD, surgery, a vasectomy for men or tubal ligation for women. Talk with your doctor about what method is best for you. Many health insurance plans help cover the cost of birth control. Most birth control methods do not protect you from getting an infection. What is safe sex? Safe sex means taking steps to prevent STIs. Sexually transmitted infections, or STIs, are infections that pass from one person to another during sex. This can be a problem for both men and women. There are many different types of STIs, such as herpes, gonorrhea, HIV/AIDS, HPV, syphilis. You may or may not have any symptoms. Annual checkups can screen for possible STIs. Get medical care right away if you or your partner have any bumps, sores, or unusual discharge. How to prevent STIs? Abstinence or having no sex. This is the only sure way to prevent an STI. Condoms, worn by the man during sex. This is the only birth control method that can also help prevent the spread of STIs. Practicing safe sex is important for both men and women.